The reproductive health law is now the subject of oral arguments at the Supreme Court, and one of the proponents of this law has recently been appointed to the Department of Health. Please welcome former Iloilo Representative and now Health Undersecretary Janet Garin. Good morning, Usec Garin.
Good morning, Annalyn. Good morning, Claire.
Thank you so much. First of all, congratulations on your new appointment.
Thank you.
How has it been so far, and what are the challenges that you foresee being a Usec of the Department of Health?
Well, basically, the turnover of some of the programs is quite challenging, especially that you have to look at the neglected problems that seem so minor, but now looking at the figures, these are things that should be addressed. We have, of course...
What are these neglected problems?
Well, basically, we had a lot of programs on nutrition, but aligning them with the Department of Education, the Department of Social Welfare and Development is something that should be done. The government has been spending a lot on feeding programs and daycare students and even kindergarten students. If you remember before, there was this 1 kilo of rice for every day that a student goes to school. Unfortunately, transforming this to figures in terms of reduction of malnutrition, the improvement in academic performance of students is something that should be checked. So this is one of the challenges that the Department of Health is now facing. That's probably a mismatch of figures, or probably the system is not answerable to the demands of the kids.
What do you think are the other projects or health projects or programs that the health department should focus on right now?
Well, because of global movement and all the diseases that are evolving, it's sad to know that HIV, where in fact HIV/AIDS is reducing in other countries. In our country, it's going to epidemic levels. It is somehow unnoticed because the group that has been much affected are those of the drug users in certain areas of our country, like Cebu, and the homosexuals in some cases. But mind you, these are young professionals who can actually contribute a lot to our economy. Second is the issue in immunization. Much as the government has been spending a lot, it has to be aligned with the implementation in local government units. I've been exposed with LGUs before, being a member of the House of Representatives, and prior to that, being a member of the Provincial Board of Leyte and then Iloilo. What I notice is that good programs of the government are sometimes hindered because of the seemingly small fees, but this would be like huge for a family who has 3 or 4 children. Like vaccination, immunization is actually free. But if a health center starts collecting like an injection fee, a processing fee, or asking for needles and cottons and whatever, it dilutes the whole program, so much so that it deters complete immunization of a child. And this is one thing the Department of Health will be looking into, how to implement programs from the national level down to the local level, taking into consideration all these hindrances. Because government workers should not be collecting fees in delivering health services to our people.
What about the RH law? What happens to it now? The oral arguments are still ongoing.
Yes. And we are hoping against all hopes that the members of the Supreme Court will look at the greater perspective, not only the voice of the majority, but the fact that the RH law, or the Responsible Parenthood law, provides for a breathing space where every family can uplift its socioeconomic status. If we look at the situation, poverty has become an intergenerational trait. In Tagalog, we say, napapamana yung kahirapan. And this is something that should be addressed. Well, I do believe that majority of the members of the Supreme Court we look at it at a broader perspective, that this is something that it's a highly controversial issue, a highly politicized issue, simply because there is an institution that has been mandated to protect the infallibility of the Pope. And when the Pope before said that condoms and family planning is immoral, correcting that now would be in questioning the infallibility of the Pope. But you know, this is a minor thing as compared to the huge effect on the Filipino people. We have 10 mothers dying every day because of pregnancy-related complications. We have a lot of teenage pregnant. women. Sad to say, where before the average age of teenage pregnancy was somewhere around 16 to 18, now it has gone down to 12 to 14.
Younger.
They're becoming younger and younger and younger. Not to mention the fact that menarche, or the first day of the onset of menstruation, has gone down to an average of 9 years old, probably because of the diet and all these things.
So where do you think will this lead now? Where are we at when it comes to the RH bill?
It's something that we cannot really tell. But with the voice of the people and with the support of the tri-media sector, I believe the political will that has been displayed by our president, that has been displayed by Congress and then by Senate in the passage of this law will also be exemplified in the Supreme Court.
Okay. So thank you so much for joining us this morning, Usec Garin. And I don't know if you're being a Usec will be more difficult, more challenging as compared to during your times when you were a congresswoman, but best of luck, and we hope to see you again
back here.
Yes,
on Solar.
thank you. Well, the difference is that in the executive, programs and plans can be easily implemented. Unlike in the legislative, that you plan, you propose, you have this all amended, but each department is interrelated, and hopefully I can contribute to the executive. Thank you very much, and thank you for inviting me.
Thank you.
Thanks for coming.